Hello dear learners, today we are going to discuss about the topic enhancing compliance. So before knowing in detail about what are the strategies we use in enhancing compliance, our major objectives apart from that would be to know first what is the importance of compliance, and then what are the various measurements available for compliance and methods for improving compliance. So by now you learners have been you are very much familiar with the concept of compliance. So just let me give you once again the definition of compliance. Compliance in health context is defined as a patient's ability and willingness to follow recommended health practices. So first a client should be aware about what is the importance of compliance, then only they can realize and they can start some strategies and techniques to improve their compliance. So first we have to convince them. For that they should be aware of what is the importance of compliance. For medical advice to benefit a patient's health, two requirements must be met. First, the advice of practitioner must be valid, and second, the patient must follow this advice. Inappropriate advice that patients follow may produce new health problems that leads to negative outcomes for the compliant patients. On the other hand, excellent advice is essentially worthless if patients do not follow it. It has become of increasing concern to both health psychologists and medical practitioners as one of the main vehicles to patients' recovery and enhancement of positive health. So recently World Health Organization did a study, a kind of survey, and they estimated that about 50% of patients with chronic diseases such as diabetes, hypertension and asthma, especially those patients who are living in developed countries, are compliant towards treatment recommendations. This indicates that the remaining 50% of the patients are non-compliant, which is a major concern for the researchers as well as the medical practitioners, and of course for the health psychologists too. Now we should also know what are the disadvantages of being non-compliant or the cause of being non-compliant. By not following the recommendations offered by their medical experts, people increase the risk of developing health problems they do not already have, or of prolonging or worsening their current illness. So let me share some of the research studies which have been done on the patients with various illnesses, serious illnesses. That would be hypertension. Though hypertension is normally heard everywhere that everyone is having hypertension, it has serious consequences, and then the cancer, some cardiac problems, and people with HIV. So some of the studies says hospital admissions are substantially higher for people who fail to follow medication regimens for serious conditions such as hypertension. And some prospective studies have been done, which is actually prospective studies indicates, which is a follow-up study for the patients who had a major treatment like with serious illnesses, have shown that individuals who comply poorly with their medical regimens are much more likely to die during 1 or 2 year follow-up periods than people who comply well. For example, what kind of diseases is, two studies found higher mortality rate in heart disease patients who comply poorly to take drugs to prevent heart attacks. Another study found higher death rates among kidney patients who comply poorly to dialysis treatment. And another important study for HIV is HIV drug treatments, which is a compliance is highly recommended and highly required to survive the patient for longer time, is necessary to prevent the virus from rebounding and developing drug resistance. So if we see all these studies, which indicates these all studies are where the illness is very dangerous and where compliance is required. So with these studies we can analyze that how dangerous is if a patient is not compliant depends on the severity of the illness. One reason is that the effect of non-compliance is greater for serious and chronic illnesses than for serious conditions. For example, let me say for some illnesses 80% of compliance for the medication may be minimum level, and for some other health problems lower rate of compliance may be sufficient, maybe 60 or 50%. So it also depends on the seriousness of the illness. And now we know like what is a compliance and how important is compliance and what would be the negative consequences. Let us know like how to say. You may get question like how to say whether a patient is compliant or not. We need to have some measurement for that, and there are some measurements available to know whether a patient is compliant or not. So some of the basic means of measuring patient compliance are first asking the practitioner how is the patient, like is he compliant, is he regularly coming for the checkups. And the second one is directly asking the patient itself. And the third one is ask other people. Here other people includes the people who are the family members of the patient, or if the patient is admitted in the hospital, you can follow up with the nurses or the caring supporting staff. And the fourth one, which is more, I would say, more authentic and more accurate than the above three, is monitoring medication usage. You can check the pills, how many pills they are using or not. That is another indicator. And the final one, which is highly validated when compared to all the four above, is examining biomedical evidence. So let's go one by one and let's see what is the advantage of each and every measurement, and also what is the shortfall of each and every measurement. The first measure, asking practitioners, I would say when compared to the other measurements, is the poorest choice. Why? Because study says physicians generally overestimate their patient's compliance. And then comes asking the patient themselves, which is slightly, I would say, more valid procedure, but it also got some of the limitations, because while directly asking the patients, we use different methods like giving them a questionnaire and asking them how compliant they are, or we'll conduct interviews, or different self-report strategies we use. Some of the disadvantages are self-reports are inaccurate for at least two reasons. First, patients tend to report behaviors that make them appear at least a bit better than they are, and sometimes lying to make their behavior appear more compliant than it is. And second, they may simply not know, they may not have the awareness or their own rate of compliance. So sometimes to impress or for sake of the social desirability, they may not give accurate answers, though that may impact for the measurement of compliance. So, and then comes the another technique is to ask hospital personnel or family members to monitor the patient. But this procedure also at least two inherent problems. The first is constant observation may be physically impossible, especially with regard to practices like diet and alcohol, where we can't say like when a person goes out, he may consume alcohol, but the person who is following up may not be aware of this. So these are some of the problems which may get. And the second, persistent monitoring. Here one more interesting fact I would like to share is persistent monitoring creates an artificial situation and frequently results in high rate of compliance than would otherwise occur. This outcome is desirable, of course, but as a means of assessing compliance, it contains a built-in error that makes observation by others inaccurate. Apart from the observation, it's good because at least because patient is aware that others are observing, they may become more compliant. But we can't predict that how the patient will be in the future, because here he is very conscious, he or she, and they are trying to be compliant, but other way in the future we can't see how compliant will they be. And now comes the fourth method of assessing compliance is monitoring medical usage, such as counting pills or assessing whether patient obtain prescriptions or refills. These procedures seems to be more objective because very few errors are likely to be made in counting the number of pills absent from a bottle. Even if the required number of pills are gone, however, the patient may not have taken the medication or may have taken it in a manner other than the one prescribed. For such problems to overcome, there is one sophisticated indirect adherence measure called medication event monitoring system, which is very useful. It is a kind of bottle which contains a microelectronic chip that registers the data and time for every bottle opening assuming that bottle opening represents medication intake. So, medication event monitoring system provides a detailed profile of patient's adherence behavior. Now, the final one, which is I would say more accurate than the above 4, is examination of biomedical evidence. Biomedical evidences include analysis of blood or urine samples to determine whether patients have behaved in a compliant way. So, research studies suggest that these measures are very reliable, those even these two have some problems. Like, first, some drugs are not easily detected in blood or urine sample, and second, individual differences exist in absorption and metabolism of drugs that can lead to wide variations among people who are equally compliant. And finally, what we can do is, instead of just strictly following one measurement, what we can do is we can combine 2 or 3 strategies which would actually help us more. Now, let's see usually what kind of reasons patients say. So, in the attached material, there are a list of reasons provided. What do patients usually say for not being compliant towards a medical advice? Before that, let me share some of the reasons, and while I am briefly telling you these reasons, just cross check with yourself, just introspect with yourself how you are usually. Have you ever given these kind of excuses, or do you know any people around you who usually give these kind of excuses? So, some of the reasons would be like this. They may say it's too much trouble, or they may say I won't get sick, God will save me. And few people may say I forgot, that's it, no reason, I just forgot. And few people will say I saved some pills for the next time I get sick. And some people may feel that this doctor doesn't know as much as my doctor. Or few people may say the medication makes me sick. Actually, I feel more sick if I take medication than if I don't take. And the next reason would be I don't like my doctor. He thinks he knows everything. When doctor is one-sided, I mean he is not empathetic towards the patient may feel like that. And next, patient may say like if they are illiterate and they have a language as a barrier, they may say I didn't understand the directions on the label of the medication or the strap or on the bottle of the medication. So, these things may also influence. Now, it's time for us to discuss the methods for improving compliance. So, the methods for improving compliance, I would say we can categorize them into 3. One is educational, and the second one is behavioral and changing their behavior, and the third one is cognitive behavioral strategies. The third one, cognitive behavioral strategies, is we target the belief system of the patient and then we try to bring alter changes in their behavior too. So, let's discuss one after the other. So, briefly I would say educational procedures are those that impact information. What these procedures try to do is they try to increase the knowledge, give them more knowledge about the health practices, sometimes in an emotion arousing manner designed to frighten the non-compliant patient in being compliant. So, sometimes fear arousing messages may be very helpful to change the patient like to be more compliant, because that threatens them, that endangers their existence. They feel, oh, if I don't take, I have to face consequences, so better I take the medication. And educational messages include individual patient counseling with various health professionals. See, if after cancer treatment, if a patient needs proper diet and he is not following it, what we can do is we can take or we can recommend the patient to go and meet a nutritionist. That person, when a professional counsel them, they may gain more awareness, and then we can use different lectures, demonstrations when we are targeting a group than a single person, and we can also conduct awareness programs. Now, educational methods may increase patients' knowledge, but behavioral approaches for a more effective way of enhancing compliances. So, behavior strategies focus more directly on changing the behaviors involved in compliance. So, D'Amato he's a researcher. D'Amato and team recommended 4 behavior strategies for improving adherence, or I would say compliance. So, first, various prompts can be used. In the sense, these prompts can be cued by regular events in patient's life, such as like you can ask the patient to write what are the medications they have to take, and they can actually stick it in the place where they stay a longer time. Usually they can see it, or sometimes we can ask their family members to keep remind them, to keep call them. And second strategy is regimen. In the sense, tailoring regimen indicates designing the prescriptions or the suggestions from the practitioner's end which fits the lifestyle of the patient. Think a lifestyle is very busy person, like if he gets out of his home, he'll return in the night. He have a time in the morning and he can give some time in the night, but not in between. So if possible, doctor can make some alterations so that it will be easy for them to practice. And then comes the third strategy is graduated regimen implementation that reinforces successive approximations to the desired behavior. For example, a patient needs to do a good amount of exercises to overcome his health consequences. Instead of giving him a huge list to do jogging, yoga and exercise and some workouts, what they can do is doctor may ask the patient initially to do just walking, and then he may ask do walking with some jogging. Then he may ask add some meditation and yoga, and then they may ask to do some cardiac exercises. So what he is doing, he is gradually making the patient to do what they want. And the final behavior strategy is contingency contract. It is an agreement, making and written agreement between the patients and healthcare professionals. They feel that they are more obliged to do, they have to do. So that sometimes may impact and that may feel a patient more responsible. And then comes the third one, which is very effective because I would say a cognitive behavior strategy is a combination of education as well as a behavior strategy. So it includes training patients to monitor their health related behaviors. Doctor may suggest them is to monitor their health practices. Like in the night, once they are done, they can maintain a journal, they can maintain a diary, like how they followed, where they missed actually, why did they missed, and all. So that make them patient think again, and to evaluate those behaviors against a predetermined criterion, which I was telling till now, just to cross check with it, and to increase patients' self-efficacy for compliance to healthy behaviors. So here, let me tell you what is the concept of self-efficacy. Here, self-efficacy indicates a patient's belief that he can successfully do a task. So when you help the patient to strengthen their belief that yes, I can do, even though taking medication is difficult, I can overcome, I can do it. So this will help them to be more compliant towards their health, and to use positive self-reinforcement. So self-reinforcement indicates, let me give you one example. What client will think is, if I take my medication regularly this whole week, I'll go for a movie. So what he's doing is, he's reinforcing by himself with something positive. And next comes cognitive behavior interventions, like that are aimed at improving patients' knowledge of their disease and of consequences of non-compliance to treatment. So these are some of the important strategies which will definitely help the patients to overcome being non-compliant and follow the prescription given by their practitioner. Now, let me share one small intervention which where lots of studies have been done, and there is small intervention which if practitioners use towards compliance, that will be very effective. Now this whole intervention as an acronym, we call it as SIMPLE. Let me tell you what is this SIMPLE strategy about. Now S indicates simplify the regimen. So here simplifying the regimen, which I already discussed before under the behavior strategy, here simplifying the regimen in the sense adjusting the time according to the patient. If he is busy, adjust the time, and also adjust the dosage. See, like to what according to the age. If he is an old age person, simplify the medication with a less dosage so that he can take, or frequency of medication, and then matching regimens to the patient's activity of daily living, which I was telling. And next comes I, which is imparting knowledge. Here let me give one more example. Imparting knowledge includes focusing on patient provider shared decision making, where patient as well as a practitioner comes to a conclusion together. It should not be like one-ended. Even a patient should get satisfied. And next, advising on how to cope with medication cost. For example, see, if he belongs to below poverty line and affording medication which is very costly is very difficult, and this is one of the reason why patients stop taking medication. So for example, doctor may say the availability of generic medicine where it costs only half. So if that kind of knowledge have been given, definitely they'll get encouraged, then they start being compliant towards the doctor's prescription. And now the next one is providing all prescription instructions clearly in writing and verbally. Ensure it that client understood the prescription, or else doctor can ask the patient to read out whether he understood or not. And next, the acronym in the simple comes M is modifying patient beliefs and behaviors. As I was discussing about cognitive behavior, modifying the belief definitely results in change in behavior. Example, ensuring the patients understand their risk if they don't take medicine. And now, providing rewards for adherence, in the sense for the compliance. If they are very clear, if they are following their medication properly, appreciate them. Tell them that you are really a good patient, you are following that. If required, doctor may take this patient to create awareness for other patients that also reinforce them. And next, P indicates providing communication and trust, in the sense providing emotional support, actively listening to patient. Active listening indicates not only what patient is saying, also the body language of the patient, and using simple and plain language so that the patient can understand. And then what doctor have to follow, it comes to L. Here L indicates live the bias. In the sense, patients come from different backgrounds and different multi-cultured. So doctor have to be aware, he have to be empathetic towards all these cultures. So he has to design in such a way to educate the patient level of understanding. They should be able to understand. And next comes the final one is evaluating adherence, in the sense counting the pills. So here again the same strategy, just by counting the pills, doctor can know how they are following their medication or prescription. So asking about adherence behavior at every visit is also important. How they are, what are the problems they faced while following the guidelines, and periodically reviewing patients' medications container, noting renewal dates. All these things are very important, and these are the contributions what doctor can do towards improving the compliance of patients. So now let me just summarize quickly about the effectiveness, or what are the strategies to strengthen the compliance. So first we discussed about the concept of compliance, which is being or following guidelines followed by the patients accordingly to the practitioner. And then being compliant will help the patient to overcome the health consequences very easily, and they need not to go to the hospitals regularly, and the death rates of people who are very compliant is very less. Especially for the severe illnesses, being compliant is very important. And then we discussed about measuring compliance. So here measuring compliance, we discussed broadly 5 categories. First, directly asking the practitioner, then followed by asking the patient, then asking other people, and then monitoring medication usage, and finally considered to be very authentic, examine biomedical evidence. When compared to the first 3, the last 2 are considered to be more authentic in assessing the compliance levels of patients. And then we discuss followed by about the reasons, what kind of reasons patients may say. They may say it's too much trouble, they may say I have too many pills to take, and they may say the medication makes me sick. So putting these things into mind, some of the methods for improving compliance have been designed. So first one is educating the patient, in the sense giving them awareness, trying to give them knowledge. And then we discussed about 4 behavior strategies, like using prompts and cues, and then we discussed fitting the strategies according to the patient's requirement. And then we discussed the third strategy as graduated regimen implementation, which is designing gradually, making the client follow the guidelines gradually but not at a time. And final behavior strategy is contingency contract. It's a kind of agreement takes place between the patients and healthcare provider. And then cognitive behavior strategies, which we discussed about training patient to monitor their health related behaviors, and then evaluating them with the standards, and then improving their self efficacy. And finally, we ended with discussing practitioners' contribution to compliance. This intervention we call with the acronym as a SIMPLE. S indicates simplifying the regimen, I indicates imparting knowledge, and M indicates modifying patients' beliefs and behavior, P indicates providing communication and trust, L indicates living the bias, and evaluating the adherence through counting pills, checking their regular periodic schedules and all. So I hope this session or this discussion have been useful for you learners, and the attached material and remaining sources would help you to understand in detail about the important strategies involved in enhancing compliance. Thank you.